Hello.
Hi, ma'am. Really waiting I was waiting for the session, ma'am.
That's nice. Yes. I've been just trying and hoping I can sort of do something, uh,
Yeah, ma'am.
see what is the problems everyone is facing. But let's see what comes out of this today. Let's hope we can do something.
Yeah, ma'am. Yes, ma'am.
And so, what are you doing now?
Ma'am, I'm a reader in college, ma'am, in Sri Shankara Dental College in Varkala.
Okay, that's nice.
Yeah.
So, good. Okay,
So
let's
that
welcome Dr. Uma. Hi, Uma.
Hi.
Hi,
So, welcome.
thank you. I'm
Right.
really excited to join this meeting, and I was also searching for kind of a meeting.
Thank you. Yes, we are excited to have you, which is sort of so that is Dr. Mega also is with us. She's a reader. And what are you doing, Uma?
I recently joined as a consultant oral pathologist in a cancer research institute here in Bangalore.
Okay.
I'm basically from Kerala, and now I'm working in Karnataka.
So we have someone else who's connecting, Dr.
Rekha.
Rekha. Yes. Right. So tell me, what are your respective plans? So, Uma, what is your plan now? I mean, how are you facing whatever challenges you have? Do you have any challenges happening right now, or you are comfortable with whatever is happening in life? As far as oral pathology goes, I know COVID is not exactly the most comfortable time on earth, but otherwise.
Yeah, otherwise, I recently just graduated 1 year back, so I was also facing a tough time. I was also searching for job, and I really didn't know what to do. Then I luckily found this in a website and found this vacancy. Now I think I'm happy with this research field, but then I feel something more to do or something innovative to do because this is just a kind of uh, I'm not really into the research activities. I'm actually a consultant pathologist here. So I should do, I feel that I should do something of my own. I don't know how to continue this.
Research to just give it a thought is research does not necessarily have to be something you do in the lab. Okay. We have primary research and secondary research. So secondary research is basically when you work using other people's results, which essentially comes down to being a review, right? So it can just be a systematic review, or it can be, you know, it can be meta-analysis, or it can just be a review. What I would suggest is that you pick up a subject, any topic that is of interest to you and that you would really want to work on. And first and foremost, just do a review on any one topic. There is so much happening and so much that has not been updated. So don't just sort of let that time get away from you. Lay down the the background, the research, the foundation for your future work. And by the end of the year, you will hopefully come out with actually a publishable review that will then make it much easier for you. Say you want to do a study on a related topic, when you want to look for funding, whether from your own institute or maybe ICMR today is also giving some funding, it will be much easier because you already have work in that field. What do you, Mega? What are you planning to do for your future? Are you happy?
Yeah, actually, the thing is, I feel it is quite pathetic, ma'am, in both clinical and academic ways, especially students now who are passing out. Most of them are not getting the job at an easy go, ma'am, and most of them are having layoffs, which is a reality,
Yes.
brutal reality actually, and they are not able to make their survival. We have to do multiple things to actually make our survival, and we need to really think on the futuristic aspect for others also, ma'am, not only for us, even
Correct.
for the future students who are coming in this profession, before we lose out the charm. And now if you see colleges also, always there is a consolidated pay. Even if you go as a consultant, they try to call you less and more of an oral medicine person or a surgeon person for a review. Maybe there there is an intervention needed in proper grading and description of the jobs in government and private sector. Also, even in the cancer centers, ma'am, because one of my friend is he's an associate professor in a regional cancer center here. He says, like, you know, if community people, oral pathology, medicine, all of us can work in these tertiary centers or the primary centers, we can stop progression of the cancer to the advanced stages if we all work together. So maybe a government initiative also is there required. As of now, I've started with research, ma'am. I have applied for the PhD program in AB Shetty. Yesterday, I finished my interview round, ma'am.
Okay.
So I'm
All the
hoping.
best.
Yeah, ma'am. Thank you.
Okay, let's welcome Dr. Rebecca.
Yeah. I can hear you. Hello, ma'am. How are you?
Hello. I'm good. How are you? Okay, Dr. Rekha also has joined in. Welcome. So, Dr. Rebecca, we've been hearing so far, Dr. Megha is teaching and Dr. Uma is in the private sector, actually working for a hospital in Bangalore. And what are you doing?
Okay. I'm working as a lecturer in Madurai, Tamil Nadu.
Okay.
Yeah, it's been
So
a
one
year.
more
That's
state.
it. And I'm interested to further my career, actually thinking whether I should do a PhD or what else can I do in oral pathology. You know, because our Indian scenario, you know, doing fellowship in oral path is also not much of, you know, I don't see any openings there. I know soon after I passed out my MDs, I tried for looking for a pathology in head and neck, yeah, head and neck pathology fellowship. I was trying for it. Then I could see entire India only in Malabar Cancer Institute, Kerala, they were offering. So I just applied for it. Then unfortunately, I didn't get through that, but that's fine. But I'm looking for other opportunities, like, you know, in which way I can further my career.
But you basically are like interested in research.
Yes, of course, I'm.
Yeah, okay.
I'm
So that's good. I mean, I must tell you now, I have been an oral pathologist for 25 years now. And yes, at this point in time, or rather in the last, I would say almost 8 years now, I think I would describe myself more of a researcher than an oral pathologist per se. You know, like my interest has gone more into research than stay in oral pathology. Although I set up a center in between on my own after I left in 2013, I set up my own dental center, a rural dental center, more of a charitable thing. And the idea was that I would have oral cancer patients around me, you see. And under the cover of the doing dental care, they would walk into my clinic and I would be able to sort of intercede at some point in the process. Of course, now, anyway, that also is shut. So just moving on to the next stage. And yeah, these are times where things are different. So if you're thinking of PhD, I mean, anyway, everyone is thinking of different things. So what are your you're thinking PhD in India, out of India? What are you thinking?
I feel all this time, you know, these many years, some 8, 9 years, we were in dentistry, did our graduation in India. So I'm thinking we are doing, you know, research. I feel why don't we try in abroad? I'm thinking that, but I've not executed. I feel, however, you know, we'll be spending some 4 years or 5 years of our research. So, you know, the general thing that makes me to think of abroad is the laboratory setup there. And they are, you know, in India, we need to, you know, this entire thing is different.
Yeah, you know, actually speaking, just before, in fact, the reason I closed my center was that I applied and I got a PhD in New Zealand. So, but of course, the world shut down and I couldn't go. But I'll continue. Okay, so the basic reason why I tried New Zealand was basically that I would get an entirely different way of doing things. Okay, being able to work on the actual, you know, technology, on the equipment, and we already know. I mean, both as a student, as a teacher, we know how things work here, and sometimes it's good to get a different experience. Now, if you want to do a PhD out of India, and one thing from what I know so far is that the PhD is currently accepted across the world. So if you have a
Our
PhD,
PhD.
it's not like our MDS or a BDS, which is not accepted around the world, you know.
Mm-hmm.
But a PhD by virtue of being a research degree. So if you're doing a PhD
Mm-hmm.
and you're going to go somewhere else, because you're not going to be practicing, you're going to be doing research. So then that
Mm-hmm.
no, licensing problems do not exist. And if you want to do a PhD today, the options internationally, of course, in India, there are many centers, no doubt,
Mm-hmm.
and they're good centers. But internationally, if you want to do a PhD, I think of course, where everybody likes to go is the US. The US has a requirement besides the language requirement, which almost everywhere you would have to give an English test. But besides that, what I found the biggest block was sitting for the GRE, the graduate exam, that you answer basic science and maths and calculate the, I don't know, the area of a sphere kind of a thing. And I just couldn't get myself to study that, because every moment I was studying for that, there was this little sound at the back in my ear saying, waste of time, waste of time, waste of time. Like, so obviously it was not a successful effort. I couldn't get myself to think how all that is going to be helpful now. So that was not a particularly successful effort as such. But there are other, of course, see, you all are younger. You are still not that far away from when you did your UC and so science is still fairly fresh in your minds. So I think if you want to just do a course, it should be okay for you. But otherwise, is Europe. Europe is a very good destination. Most of it is by scholarship, is merit based. So you would have to cut this one for the make the merit requirement. Also, they tend to be not taking anyone over 35. So if you want to join them, you need to do so earlier on in life.
Okay.
Another thing is Australia, another very good place. Okay. Now, Australia and New Zealand have this very interesting system where they, unlike in India, you know how it is. If you want to take an admission somewhere, you want to join a course somewhere, you go apply and you get an admission, and then they suggest you who's going to be, say, your supervisor. And then we take it from there. In New Zealand and in Australia, it's the other way around.
Australia.
First, you identify someone who agrees to be your supervisor. And when the person agrees to be your supervisor and you have a letter from them, then with their help, you will work on your proposal. And then you can apply to the university for a PhD.
Okay. So then we already have a support there.
Yes, you have to know someone, you have to get to know someone, and then you have to work on it, and then you have to apply. And of course, another very good place is also Singapore, which is very advanced in as far as medicine goes. So we have Dr. Harshada and Dr. Rekha. Okay, let's start with Dr. Harshada. I can see you're at work.
Yes.
Okay, that's nice. And how are you managing with work now?
It's going on. It's going fine. It's hectic, but it's okay.
Where are you from? And what are you doing?
I'm from Mumbai. I'm
Okay.
a pathologist, but now I'm practicing.
And Dr. Rekha also is with us. Hello, doctor. So,
Hello,
what
ma'am.
about you?
Ma'am, I'm fine, ma'am. I had completed this last year in 2019, and then I'm searching for a job.
Okay. Yes. So the catch is, what do you want to do? Do you want to go? I mean, the fact is that really joining a job as far as colleges go there is very little chance. So what are you thinking of in the long run? What is your next plan?
I'm thinking about, ma'am, for the PhD, ma'am, but I wanted to know whether it is actually beneficial doing a PhD. because after MDS it is like we are sitting jobless. So again PhD.
I think PhD is something that requires really a dedication, that you really want to do research, because PhD is a very dedicated research degree. That is one aspect of it. So if you're doing it only for the purpose of whether you're going to get more chance of getting a job, well, it will open one more venue, because with a PhD, you are not then necessarily limited to getting a job with, say, for example, the dental colleges, which is the situation now. Okay. If you have a PhD, you can join the pharma industry, you can start, join industry basically, the various levels of industry, whether pharma, whether medical, and in research. You definitely can. You can also join, but many biotechnology firms also for research. But that is all, again, I don't really know how many people are doing those PhDs, and then what is the numbers in tally to those jobs. So that is one thing you should keep in mind. It may or may not necessarily increase your chance of getting a job. And let's ask Harshada, what are you planning to do? Are you planning to just stay in clinic, or this is a, sort of a something to get you over a gap?
Yes, so because there is no other alternative that I can see, being in Mumbai,
Correct.
there is no scope of any educational academic career. So I went out with clinics. And apart from that, from my side, I wanted to go in the field of research, like any project which I can get into, or any of sort of oral cancer related field which I can stick on to. I'm just looking for something opportunity, maybe any fellowship, or maybe it be any course through which I can get into it. So if anything like that, it will be good for
Right.
growth. That's it.
So are you actually looking up, say, all the job, whatever comes up in the various research?
Exactly.
Okay. So these are both things that,
The problem comes here, like whenever, yes, ma'am, yes, ma'am.
no, tell me, tell me.
So the problem comes here, like whenever I try to apply to any of the projects which are coming up, so they ask for experience.
Okay.
So that's where we lag. So it doesn't happen. That's
Yes,
the thing.
this is a common thing. So depending now on what I have been really suggesting to many of my ex-students and many who really talk to me across, two things. Once you decide whether you really are looking to be in actual oral pathology, okay, where in the diagnostic oral pathology, let's say, then you have to build up that skill, okay? And if you're looking to go into research, then you have to build up that skill. The skills here differ. They sort of split at some point, right? So it really is all
Yes.
about finding what you are thinking of doing in the long run, and accordingly working. Now, if oral pathology is what you're looking at, if our good old diagnostic oral pathology is what you're looking at, what I generally tell my students and youngsters is, don't think to begin with, don't think of the money, don't think of the earning, okay? Approach pathology labs, centers that are actually doing diagnostic work. And one thing is, not every neighborhood pathology lab does biopsy service. So you need to identify one that does a biopsy, okay? And then go there and offer to do, to sort of give your, sort of lend your expertise to begin with for free, just to stay in touch. And you can always build on the fact that you are a dentist. If you go join a lab, even if it is just that you're giving your name, and you go around to the neighborhood dentists and tell them that, listen, now I'm an oral pathologist, I'm attached to this lab. If you send your tissues, I will be the one who will report them. Right? So
Yes.
one is, you do not lose touch. And the second thing is that you, after 5 or 6 months or whatever, you can always either then offer to continue with them if they are ready to actually take you on their panel, or then you can just say, okay, fine, now I have this many months of experience, and you can just give me, if you can give me a letter. And because that then gives you the first experience,
Yes.
right? Also, what I have found now, right from when I was doing my MDS, which was, I finished in 97, okay, 94 to 97. It was a long time back, things were different. But in a lot of places, it has still not changed, and I am aware of that. Okay. So like when I finished my MDS, oral pathology, we have this very good family friend who's a general pathologist who has a lab outside. So I finished my oral pathology and promptly came and went and joined him and worked with him for 6 months to learn pathology. And let's face it, if we are looking for a future where an oral pathologist can work as an oral pathologist, irrespective of a job or an opportunity in a dental college, which obviously is going to be limited. We are not going to have more and more colleges forever. So we need to know, we need to train ourselves to match that standard of being in a general pathology, being a part of a pathology lab base. If you are thinking of continuing as an oral pathologist. On the other hand, if you are very, very definite that you want to get into research, you pick up different topics, you do a research, you do a review. Now there are online courses on how to do meta-analysis, how to do systematic reviews, and how to do reviews very well. Because then you will also find out if you really research is your thing, because research can sound very fun, but can be very repetitive. Okay. It's a total process of, exactly like it says, research. You have to do the same thing over and over and over again, and very often not get much result. So it also gives you the time to find that. Maybe you all have suggestions that you can share with each other of what should be done, what you can do.
Ma'am, I would like to know about the forensic odontology courses. I'd like to know, like, how will that benefit us?
Question, I guess, by the way, was from Dr. Rebecca. Now, the thing, I had a lot of opportunity to go on and do a lot in forensic. In fact, I set up the first oral pathology actual department in forensic, which was in CODS.
Yeah.
But I did not want to do more in it because there may be a day where you have to think about mass disasters and you cannot stay away. If you're a forensic odontologist, if you're a forensic person, it would be unethical at that moment not to lend your services. Right? So I know for a fact that I do not have the kind of mental makeup to be able, and I admire those who can. So because that's definitely a job that needs to be done. So if you want to, I have to frankly say that I have not followed forensic dentistry very closely because it is of no particular. But I do have the context. I think that one person who can tell you a lot about forensic dentistry is Dr. Ashit Acharya, who will be able to give you a better picture of what it is like and what are the opportunities. But logic says that there should be opportunities because there are still very few, and definitely around the country. So there should be definitely opportunities should be there. Although I don't really think colleges employ forensic odontologists. I think it is more government, possibly.
Ma'am, I just have something to add to this actually. Everyone is like, okay, we'll do a fellowship, so we'll have an added degree, so we may get another option. But trust me, ma'am, I have been to a lot of interviews, and you will not believe, amongst 40, nearly 30 to 35 have done fellowship, and most of the fellowships are not recognized, and most of the fellowships are not even considered by even governments, ma'am. There are no much available academic post. Only center that is recognized in India is now SDM Dharwad, which is of course held by Dr. Ashit sir. And as of the job opportunities, when we come, ma'am, most of the times they prefer forensic science people, because forensic odontology is again part of it. So the preference for job in crime sector and related to I mean, the crime options, there they prefer forensic science who are from a background of BSc, MSc, forensic science, stuff like that. So again, in college also, we are not having like forensic attached to oral pathology.
Just this little thing I want to say, So we were few, although there were few colleges, but then we were also few. So everybody got a job. But things were very different. We came out expecting that not too much. But today things are different. And I think sadly, a lot of the youngsters who got into oral pathology came out expecting the same situation to continue, where you would get a job literally on the virtue of holding a certificate. That is not really there, and that is actually not there in any other line of work either. We have just basically not sort of trained our students, or told our students that anything in dentistry or anywhere in dentistry or maybe even medicine, there is a possibility that you would have to compete for your job, right? And that is a disadvantage, because you have a mindset that says you need to. Now, I need to say this, if you want to do forensic even today, if you are looking at Dr. Ashit today and thinking that, wow, he is the only, he has the only recognized center, but it was not easy for him. You're seeing him at the end of a very hard work and a hard road. And that is what matters. There's this book recently I've been reading, it's something called, I think, It's So Good That They Can't Ignore You. And it is about the same thing, like they say, if you want to reach mastery within anything, you need 10,000 hours of deliberate practice. And then you get that good, irrespective of what, you will find your job. You will find someone who needs you, but you need to put in that many hours. You need to put in that dedicated hours. But the point is, you have to find something that you like, and you can, sort of dedicate yourself to that much. And then it will work. But just thinking that, yes, I'll do this, degrees don't really prepare you. They prepare you for anything. It's the base minimum that you have, and hundreds and thousands pass out depending on what the degree is. Like oral pathology right now, we are, I think, around 5,000 in India. So there are a lot of us. Essentially, we are not few anymore. There are a lot of us. So what really sets one apart from the other? Let's say, even if there are limited jobs, what sets one person apart from the others is really just how good you are. And the how good is not decided by, how many hours you sit in the oral pathology department. Okay. Whether you are a student, it's not just physically being in oral pathology does not sort of, infuse oral pathology knowledge in you. No, you have to be actively involved, whether it is oral pathology, whether it's forensic. So if you want to do anything, I would not dissuade you. Even if you want to do forensic, if you want to do forensic, and you are ready to put in the hours and to put in the effort and to believe and know that to begin with, it may be very, very difficult. You should. Definitely you will need forensic dentists, and there is an opening. It's not that there is no opening, but yes, it is going to be competitive. Do not assume that you hold a degree and you will get there. No, you will have to get that good and then get in there. But that, I think right now I can say, that's the same as I was saying, as an oral pathologist, you hold a degree, wonder to you, but you need to actually go and learn oral pathology, and you need to learn not just oral pathology, but you need to actually learn pathology and simple regular lab practices and stuff like that, It's, and you need to that makes a difference. So, yeah, I don't know if I answered your question, Dr. Rebecca, after we went round the world and came back, but
Yes, ma'am. Yes, ma'am. Good answer. And Dr. Wagner also added to that.
have I been able to give you all some points that
Yes.
will be useful? I don't really know.
Yeah, definitely.
No, actually, it's like you have made us, especially the reality thing, what we are scared to face. You have told us how smoothly we can, lend our services but start our career. I think that's a big takeaway of today's session.
Correct. Very often we think of, when we think of our job or we think of our career, we are thinking of what the world can give us, you know, in terms of what the world can give me today as a doctor. Okay. But we need to now begin to think of what we can give the world as a doctor. And then in that, we will find our place. Now, don't misunderstand me. I'm not saying that you need to all go and practice for love and good air, fresh air, but because I do realize that is not possible. Okay. And I do not think there is anything wrong with expecting to earn a living from something you have put in so many years of work. But it takes time to reach there. Yeah. And sometimes you have to settle in for smaller amounts, for maybe even a little bit of no earning, and consider it as a part of your training. And in between, if you can, and of course, if you do finally need to have an earning, so if you have to, you can always look around at things like giving your services in, there's a lot of medical literature writing, where you can actually help in writing literature, freelance. You can do some courses on those, very short courses that tell you how to do those things. There is, in fact, at this moment, I don't know if you would be interested, but I think most of the state governments are employing anyone with a degree, medical degree, to help in the COVID fight. Definitely join the fight and you will learn a lot of things. Another thing I would suggest is if you can go to the labs where they are doing the tests for COVID. Okay. Say that, yes, I'm holding this degree, I would like to volunteer. And especially not the labs that are doing the rapid antibody test.
No, ma'am,
Learn there.
actually, the dental associations
Mhm.
throughout India they are having requirement for interns and newly passed out students. Everyone, whoever is interested, ma'am, there is no criteria.
Yes.
You have to approach the association, and they will help you to join the mainstream.
Correct.
In Kerala, we are right now following that, ma'am. We have asked all the interns in whichever area they are to get associated with the IDA association and join the COVID testing centers.
Yes, but I would say I'm going a little beyond that. Not the test centers where you're just collecting samples, and not the ones where you're just doing the rapid antibody test. If you can go and volunteer at any center where they are doing the RT-PCR, especially if you're thinking of research, it is something that will be useful definitely in today's world. So, I mean, think a little out of the box. Think a little out of the regular to see what sort of experience you can build up. Keep working on it. Work on writing a review. Work on learning some new skills online that will help you. And see, and definitely there are centers. Quite a few of my ex-students have joined different hospitals, not not in their pathology, but if they are having a research thing going on, like someone is joined the diabetes research. At the same time, we realize there are a number of people like me who realize that we need to create more jobs for our youngsters. And for that, we really need to get into a fight with the government and with the industry, with the health industry, to make it essential that you have an oral pathologist reporting oral pathology reports. So that will actually bring in a requirement in every single hospital.
Yes, yes. I've been thinking this, ma'am, recently actually. Every government institutes and other bigger institutes, they recruit MD pathology. Never an MD or pathologist has been recruited. But throughout India, we have so many dental colleges giving MD as an oral pathology. So what would be their job scope? Nobody is ready to take them in. So I was thinking, why don't the hospitals need a oral pathologist? So I was thinking, like, how can we influence these institutes or the Dental Council of India, IDA, or whichever is, governing this pathology body.
Well, I have
Yeah.
fighting this battle through our association, through my contacts with a number of people. It's probably
I
Thanks
think
for standing for us, actually.
they have ended up getting permission to do hematology tests from oral pathology people, ma'am. I think that's the
Okay.
only achievement till now.
when that has
I
happened.
see. I
You see,
see.
the thing is
Yeah.
very simple. It is finally, you have to accept what I have been trying to say is it is economics, right?
Mm-hmm.
We know that we are better at diagnosing oral pathology. But the point is the hospital does not see the need. Why? Because general pathologists who are already on their panel are reporting it.
Yeah.
Now, the only point or the only way that I see this whole system changing is if we manage to get public support and public awareness that we as oral pathologists are better at reporting oral pathology tissues. And when the public is aware, and then we can start pushing the insurance companies next to say that when you have advertising that, and when a hospital is advertising tertiary care, specialized care, and they do not have an oral pathologist on the panel, and they do oral pathology work, they are actually not doing the best. They are not actually doing tertiary work. So if we can manage to make the awareness so much for the public to say that you are charging us for the best care, but you are not giving us the best care. Because there is the best available out there. If there were no oral pathologists, no one could say anything. But there are oral pathologists available in India, enough of them. And you are choosing, because it is cheaper for you, you are not really employing them, and therefore you are not giving us the best that you promise you're giving us. So unless we bring that, but that is a multiple stage thing. First and foremost, we need to get the public aware. Let me ask you this. I mean, it happens to me all the time. When you meet someone new and they ask you, what do you do? And you say, I'm an oral pathologist. What is the general reaction?
They don't know.
Dentist
No,
or
they don't.
pathologist.
What is that?
They don't know, ma'am. They are not aware of that.
Exactly.
They don't know.
Then you attempt to say, okay, I'm like, within dentistry, we are pathologists who do the same thing as pathologists do, but we do it for the mouth. And then out of that whole description, what does a person take away is, oh, you're a dentist. Right? So that is the first thing we have to overcome. I mean, nobody questions an orthodontist. You say, I'm an orthodontist, and they know what's an orthodontist. Right? Why not an oral pathologist? People need to know we exist, then they can require us. If they don't even know we are there, why will they need us? It's like every other kind of need. Unless you know about the existence of something, there is never a need for it. I think one should start with a fixed goal. So maybe, have a 1-year goal where this year is dedicated to getting oral pathology known. And then next year we go to the next phase where we say, now that you know who we are, now you need to know that you need us. And then we build on the next stage from there. That I have a lot of plans. Let's hope it works out and it sort of gets us somewhere. Because earlier on, we were at a point where we felt we needed to focus on oral pathology. We needed to get the science to a standard level. We needed to work on getting the science right, modernized, standardized. But I think we are past that now. We are definitely a recognized science. I think now we need to focus on the oral pathologist. We have the science safe. Now we need to save the oral pathologist, without which there will be no science anyways. So that is the next stage now, is focus on the oral pathologist. Yeah.
Ma'am, one question.
Yeah.
If we need to spread in community that we exist and we need to be focused on oral pathologists. So And the public health dentistry people should be made aware of such things. Like if they emphasize on the community when they go to camps or anywhere, if they make awareness that such people do exist, won't it make a difference in how people will approach? Like, just asking, like,
No, you are asking,
are
but
they
I
responsible?
think I find it difficult to ask others to do anything for us if we are not ready to do it for ourselves. You know,
That is true.
we got to take the first step first.
That is true.
What are we doing? We are the oral pathologists. What are we doing? I don't know if any of you, I'm sure all of you are on Facebook, right? Now on Facebook, I have my oral pathology and dental research page. And I have had the toughest time because, you know, where Facebook, you have to fill in the about the page, right? And the about says what is your main focus. So, and they have pre-decided things. So they had education, they have science, they have dentistry and clinical practice. Okay? There is no oral pathology. There's oral surgery, but there is no oral pathology. It's the same on LinkedIn. If you put your job, there is really no oral pathology. Okay? It is the same on most countries' visa forms. There is no oral pathology. They at the most say dental specialist. In so many places that are even science related, at least visa forms, you can say, okay, I'm like, they don't know. And how many things can they list? So I mean, like, we got to start in those ways. We got to literally get our voice heard. It's like normally, if you notice, whenever I see a post by an oral pathologist, I put a like, irrespective of what. Why? Because I wanted to get more hits.
But
Yes,
ma'am, we speaking at our level, I don't know how much influence it can cause.
drops
It
make an
do,
ocean, my dear. Drops make an ocean.
that's
Instead of sitting and
Just
cursing
think
for
about
years
it.
to come, we are facing this problem. It's better we work little by little, and maybe after some years we are able to achieve it.
Yes, exactly.
At least we are going to secure future oral pathologists a better position and value in society, I think. And then eventually to us also.
In your lifetime, definitely. You all are still quite young. It should certainly definitely work out and be of some use to you in your own lifetime. And anyway, it makes a difference. The strength of an entire, of any profession really depends on the strength of its individual members. So our relevance is really decided individually. And never think that your individual ones don't count. I'll tell you one thing. You think of any, do you think my single, if let's say there's a post, okay, and I put one like, and 50 of you put a like, which has more weight? Definitely the 50. So it makes a difference. It definitely makes a difference. There's so much to be done, so much that can be achieved, but we can all make a difference. Yes, I agree that it may be, I mean, I have the advantage in the earlier times I could easily get a job. I have a savings that now that I do not have a job, I can fall back on. I have also throughout actually my career, right from when I finished my BBS, I have also been holding a post as a financial advisor to our company. And so, I mean, that's another thing because I'm good at finance and I think in it, and I have certain amount of management skills that come in. But literally, I've held two posts almost all my life, I would say, all my working life. So that sort of allows me to do a certain number of things in a little bit more relaxed way. And that, which is why I feel that I need to do this for everyone else who can't. But but yes, at the end of the day, the support counts. I don't think I alone will be able to do anything. Um, I will need the support that whatever is possible. And I think that should be it. So I don't know if we answered some of your questions. And now I hope all of you will get sort of to know each other. And You can help each other because sometimes you're all from different parts of the country. So sometimes you find out about a job and you know you don't want it, and I think you should share it with others. It's a difficult time. Can support each other in whatever way, and it will come back. I think whatever good you do will always come back. So it should work.
Thank you, ma'am, for inspiring us always.
And really appreciate your efforts to
Uh,
towards all these things, ma'am.
more webinars online, I guess. We're
ma'am.
expecting more webinars. Such webinars, ma'am.
And I don't know. Do you feel we should have one more of these after some time?
Yes, ma'am. Sure.
Yes, ma'am. Sure, ma'am.
Sure. Okay.
Yes, ma'am. Yes.
Okay. So we'll see. I don't want to, have it too often. So maybe we'll organize one next month.
Yes, ma'am.
After a month or
That
so.
would be fine.
Yes,
Fine,
ma'am.
ma'am.
Sure.
Yes.
Ma'am, I wanted to know one thing, ma'am.
Yeah.
Ma'am, regarding going outside abroad, ma'am. Ma'am,
Right.
what is this FRC path examination, ma'am?
FRC PAT is an examination that basically it's another fellowship. Okay. It gives you a right to practice in some countries, but that is only if you already have their degree, the basic degree.
Okay, okay. So directly we are not eligible for FRC path exam.
No. And another thing you should always remember, in most countries, even if you are there, even if you are their own student, let's say you finished your, and some have DDS, some have BDS, but even if you finish their own degrees, basically there is a licensing exam.
Okay, okay.
So you would still have to give the licensing exam. Now, what we face when we go to a number of countries are what you can say two things. First is some of them do not accept our degree to begin with. So there are BDS or our MDS, right? So they say, like, for example, you have so many hours short, you have to finish another year of training or 2 years of training or whatever. So that is to finish your degree itself. And then on top of that, you will after that have to give the licensing exam. Right? So if you want to practice as within dentistry or oral pathology out of India, then you need to go as early as possible. While you are younger, while you still remember most things, because even if you go for an MDS, they will probably want you to anyway give the BDS exam, right? And then the MDS exam. So you need to go before you have really forgotten those skills. On that, no point. Now, FRC PAT, or for that matter, our own fellowship, but it doesn't, in the current scenario, it's not going to get you a job. It's not going to improve your chances of getting a job in India, no.
Okay, okay.
One thing how I that got distracted, and I was going to tell you, pretty soon and in the next few years, I think even India will need an MDS will no longer will be enough to get an academic post in a college. Pretty soon it's going to be that you need a PhD to get an academic post. So like if you want to teach, in the science colleges, it's like that. So for example, you want a bachelor's, you need to have a master's. You want to teach a master's, you need to have a PhD.
PhD, true,
Right?
true.
So that is going to happen here. It's already happened in the Gulf. It's happened in a number of places. So you now need to have, and in the next 4 or 5 years, you probably will need to have. So in the long run, I think as that is another, of course, definite advantage that a PhD will give you, teaching wise also, because sooner or later India has to move on. And since they're going to have this glut of having anyway too many people to choose from, so they will decide and pick up the best. Right? Colleges now have, there was a time when they used to literally steal staff from each other. Right now we have reached a point where there are so many that they can literally pick and choose. So when you have the opportunity to pick and choose, you will pick and choose the best, right? So that additional degree would make a difference. But an FRC PAT is a lot of work, and I don't really know. I will try and find out from people whether an FRC PAT will make, how much of a real difference it makes to you if you're planning to
Thank
study in India. Okay. If you have the time, I really suggest you pick up this book where I wrote the name so I do not forget. It is So Good They Cannot Ignore You, okay, by somebody called Cal Newport.
Yeah.
I really suggest you read that. If any of you want to do any research work and you have a topic you need help with, how to work around it, how to get through it, I'm there. I will help you, not a problem. Okay.
Thank you so much,
ma'am.
ma'am.
Thank you, ma'am.
You're most welcome.
Now that we have some new other contacts in our list now, all the participants are added to our new network.
Lovely having all of you, and I look forward to interacting with you all. Maybe next time we'll decide on some little specific topic and we will talk about it.
Sure, ma'am.
Sure, ma'am. Sure.
It was great talking to you and everyone, ma'am, all the participants also.
Yes, it was really great. It is nice. Actually, seeing faces makes a lot of difference from just, talking on the phone. All the best to all of you and whatever you're doing.
Yeah.
Thank you.
Bye.
Thank you, ma'am. Goodbye.